Now that it's September, if you currently have a Medicare Advantage plan or a standalone Part D plan, typically because you have a Medicare supplement plan, you are required by law to get an annual notice of change letter. We call it an ANOC. And it's actually more than a letter, it's like a booklet. But they have to send it to you during the month of September to tell you what's going to look different from this year to the upcoming year. And if you're like most people, you get it and you throw it immediately in the trash. Most people do not look at it. And for most years, you don't really have to look at it. Most years, we haven't had very big changes. You know what to expect. The premium might have gone up a little bit and the copay might have inched up a little. Not a big deal. That's why most people have gotten in the habit of just throwing it away. That is not the case for this year. This year, you wait for that. You wait for it breathlessly and you read it. And not just the first 3 pages. Read it because you are in for very big changes this year, no matter what company has your insurance. Humana, Aetna, United Healthcare, WellCare, whoever. It's going to be a year with dramatic changes. And a lot of that's to do with the fact that this year, the upcoming year 2025, will be the first time we have a cap on out-of-pocket spending on your drug costs. So nobody will pay more than $2,000 a year for their Part D, as in dog drugs, Part D drugs, not to be confused with Part B, and over-the-counter and non-Medicare approved drugs. So this cap is going to put a lot of pressure on the system because they're saying, okay, you're going to lose money here. They're going to make money up somewhere, right? They're not just going to say, oh, well, we'll just have lower profits. That's not how it works. So things are going to move around. You're going to have a lot of movement in your plan. If it's a Medicare Advantage plan, you might still have a 0 premium. About 70% of the country last year had access to a $0 premium plan, which is extremely popular. We don't know yet what those are going to look like. Are they going to go to $10 or $15 or $25? What we've heard from the industry insiders is that the companies will try to protect that 0 premium at all costs. It's very popular. But they'll raise all the other stuff within your policy. How much to see a doctor, how much it costs to see a specialist, how much an inpatient surgery costs. So you need to really dive in and look at it. And if you've been healthy, I hope you have, you're not really aware of what you already have because you're just like, I don't even use it. I don't go to the doctor. Or maybe I go to the doctor once or twice a year and it costs me $10, $20. You don't really know how much it currently would cost you if you would need a hip replacement. In most policies will give you a daily amount. So they'll say between $200 and $400 a day would be your copay. And then each policy will say how many days you have to pay that. It might be 3 days, 4 days, 5, 6, 7 days. So if it's 7 days and it's $400 a day, even if you're in there 10, 12, however many days you're in there, your policy will limit it to a certain number of days. So if it's 7 days at $400 a day, that's $2,800. You're like, oh, $2,800, I can do that. Other people are going to go, what, $2,800? What? Right? So everybody has a different budget, a different health. Some of us know we need to have a couple surgeries coming up. So if you do know you have some surgeries coming up, try to get them done this calendar year. It will be cheaper, no matter what Medicare Advantage plan you have. It'll be cheaper doing it in calendar year 2024 than it will in 2025. How much cheaper, we won't know until you get your annual notice of change in September. And when you read it, you might say, okay, some things went up, I get it, and I'm okay with those changes. And other people will say, what? This is some drastic change. For example, one of the largest carriers has already told us, I can't legally tell you who, that they're going to get rid of their dental benefit. Well, a lot of people bought that plan because of the dental benefit. And if you're still getting dental work done, and that's the reason you bought that plan, you know you'll be shopping because you want to get another plan that does have some or as good a dental as what you had in 2024. Again, if you're getting things done, you've been putting it off in 2024, get it done because your plan is changing. Now, I don't want to unnecessarily alarm you. The plan you have might be very stable for next year. Minor changes. I do want to alert you to pay attention, okay? Pay attention to the annual notice of change because it's likely that there will be a lot of changes. And once you see them, that'll help you figure out your strategy going forward, because if you need to change plans, that can't be done until October 15th through December 7th, the annual election period. And that's a very busy time of year since there's 30 million people that can change their plans. So it's great if you already know you need an appointment booked and you need to get things done, that you get in under the deadline so you can get the plan you want for 2025. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.